Today we will talk about a new study that was published in Journal of the American Medical Association by Joshua Miller and colleagues. The purpose of the study was to assess the relationship between vitamin D status and cognitive decline. To do this, they conducted a prospective multi-ethnic cohort study, which means that they followed the subject from ethnically diverse backgrounds for a period of 8.5 years without any intervention. The study consisted of 382 people with an age average of 75.5 years old. The participants were divided into three groups: normal cognition, mild cognitive impairment, and dementia group. Vitamin D status was assessed by measuring the serum concentration of 25-hydroxyvitamin D from non-fasting blood samples. The average baseline of vitamin D level for the entire cohort was below the national standard for adequacy. After that, with an average of 4.8 years follow-up period, they measured the cognitive function based on performance of four cognitive domains: episodic memory, semantic memory, visual perception, and executive function. They also measured the serum 25-hydroxyvitamin D level during follow-ups. Appropriate statistical analysis methods were used to adjust for the factors that were known to influence cognition, such as demographic characteristics, age, sex, body mass index, education, season of blood draw, vascular risk, and the presence of at least one apolipoprotein E4 allele. In this study, they found that the rate of cognitive decline in episodic memory and executive function were significantly greater in individuals with vitamin D deficiency and insufficiency. The results were independent of race and baseline cognitive ability. Episodic memory domain and executive function domain are known to be strongly associated with Alzheimer's disease and dementia. This study supports the finding of previous observational and cross-sectional studies, which show positive relationship between low vitamin D status and increased cognitive decline in older adults. However, this study is unique in the sense that it confirms the different level of vitamin D in racially diverse populations. Prospective cohort study is great for the generation of new hypotheses, but it cannot generate the causation. Besides, the study has some limitations that we need to be aware of. For instance, it did not measure the factors that might influence vitamin D levels, such as dietary intake, sun exposure, and exercise. The blood samples were collected at the time of enrollment, which could be varied by the time of the day or the time of the season, and it could potentially influence the result. We can conclude that this study demonstrated the association between low vitamin D status and accelerated cognitive decline in ethnically diverse older adults. We need better designed randomized controlled trials to show causation. Although the study cannot tell us that vitamin D is needed to prevent cognitive decline, an optimal vitamin D level can promote calcium absorption and bone health. Other news coverage of this study tend to ignore the fact that the study cannot generate causation. They stated the conclusion in much more absolute manners, which might mislead the audience into believing that vitamin D supplement can help them to prevent cognitive decline. Last but not least, more studies should be conducted to support the findings from the study. We also need to pay more attention to different kinds of research study. Not all of them make recommendations about dietary intake and lifestyle. Some of them are just giving us new idea or new hypotheses for future study. This is Lin Huyen from NFF4A9 News. Thank you for listening.